Hi there, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite parts of the country to bring you all the ins and outs of Medicare and your health insurance,
We are asking,
and answering all your Medicare questions so that you can proceed with your healthcare and wealth planning and make a confident decision. This is the Medicare Navigators Podcast. Hi, everybody. Welcome in. My name is Elliott Martin. I'm with Martin and Associates Insurance Services, and we are an independent insurance agency. We're located in Irvine, California, is where our main office is, but we are actually licensed in about 30 different states and help folks all over the country with their Medicare. Day to day, we are talking about every day, talking about Medicare with individuals. So welcome in.
hi there. My name is Becky Hatfield. I am a stay-at-home mom and the social media manager for Martin and Associates. I'm over here in North Carolina.
And today we're going to be talking about the different parts of Medicare. Right now, for at the beginning here, we wanted to talk a little bit about Part A, correct, Becky?
Yes, if you could just kind of give us a rundown of the bare bones of Part A, that would be really helpful.
So Part A of Medicare is really it's one of the two parts of original Medicare. And these are the parts that people qualify for based on their work history. So you pay your Medicare and your Social Security taxes, you qualify for Part A and Part B. Part A is the hospital coverage. So anytime somebody's admitted to the hospital on an inpatient basis, that is going to be covered under their Part A of Medicare. Usually Medicare Part A, there's no monthly premium to it. If you've paid your taxes throughout your working career, Part A can also cover things like skilled nursing. So after a hospitalization, if somebody needs to be in a skilled nursing facility, that can get covered too through Part A of Medicare. It's limited. The skilled nursing, it's really intended to be kind of short term, skilled care to get you back up on your feet. And then also things like, things obviously that nobody wants to think about, but hospice, home health care, those types of things, Medicare Part A actually covers all those different services. So that's really the core of your Part A benefits that you qualify for.
Okay, gotcha. I am a relative newbie to all things Medicare. So hopefully in this conversation, I can channel all the questions that just your average Joe has been curious about.
Yeah.
So thinking about Part A, it sounds like what you're saying is Part A is hospital insurance for the most part. It has some other components to it, some limited care in a facility, maybe after you've been in the hospital. Do I
Right.
have that right?
Yep. That's
Okay.
pretty much the crux of, or the scope of what Part A is going to cover. Yeah. It's hospital
Okay.
and
And
skilled
you don't
nursing.
have to pay a premium if you've been paying your taxes. Is there a certain amount of time that you have to have been working and paying taxes to qualify for Part A with no premium?
Yes, there is. That's a really good question. So it takes 40 credits or Social Security credits, which is pretty much the equivalent to 40 quarters or 10 years. So if somebody has earned enough each year, I forget what the amount is to qualify for a credit. I can't think of it off the top of my head, but usually most individuals are going to qualify if they've worked and paid their Medicare and Social Security taxes for 10 years. So if you filed 10 tax returns, with
Mhm.
income, you basically are going to qualify yourself for Medicare Part A and Part B. Now you have to be age 65 to then draw upon those benefits. So the example I like to use is my wife. She started working at Knott's Berry Farm at 16 years old. By the time and really worked through high school, through college, and into her professional career. So by 26 years old, she pretty much had met her 40 credit requirement. She already qualifies for Medicare and Social Security based on that work history right there. Obviously, she's got to wait a while. She's got to wait till she turns 65. As the law currently stands, maybe Medicare will bump up the age to over 65, but right now the Medicare eligibility is still at age 65. Um,
Okay.
yeah.
Now, does that apply to people that have maybe only worked part-time in their life? Like, as long as they paid taxes, doesn't matter like the hours that they work, it's more of just like that they have filed 10 tax returns.
Yeah, there's a certain amount that somebody has to earn. And once again, I can't remember that amount off the top of my head. It isn't very much that
Okay.
somebody has to earn to qualify for a quarter. But even if you're part time, you know, a lot of folks will still earn credits. The way to check to see how many credits you have, actually, if you go to the Social Security website and create yourself an account there, you can actually see how many credits you've earned over your working career. And then here's another thing about the credits is, you know, sometimes you know, maybe one of the spouses, the wife stayed at home to raise kids and was out of the workforce, and is short credits on their own work history. They can actually qualify through their working spouse. So as long as one spouse has met that requirement, both individuals will be able to draw upon Medicare benefits, but each individual needs to be age 65. So that's usually we don't run into a whole lot of issues of people qualifying for premium free Part A. It's if, you know, sometimes it's if we've got children whose parents maybe immigrated to the United States at a later, you know, later in life, maybe in their 50s or 60s, and they didn't really work in the United States, or they only worked for so long before they were fully retired, right? Those types of situations, there is an extra, you can qualify if you're short, but it is an extra, I think it's between two to $400 extra a month that the individual would have to pay to then qualify for premium free, or I'm sorry, if they don't qualify for premium free Part A, they can actually pay an extra monthly premium to qualify if there are short credits. So there's a way, if somebody is short credits, that they can still get into the Part A system and get the hospital coverage on Medicare.
That makes a lot of sense because they weren't paying taxes that whole time, so the premium that they're paying is kind of making up for all those years that they
Right,
weren't paying into Medicare. That
right,
makes a lot.
right. Yep, yep,
Okay,
exactly.
so this is very random, but my husband, who is very kind-hearted, was this these two stories I'm about to tell happened in the same day, which is so funny to me. So he visited someone who was in assisted living.
Hmm.
He said the place was like the Ritz-Carlton. He
Mm,
had lunch with this gentleman, and it felt like he was dining at a 3 Michelin star restaurant. He was blown away. So, right after that, he went and visited another person, a neighbor, in a nursing home,
hmm.
and it was like whiplash because the assisted
Mm,
living facility had been so nice,
yeah.
and then he went straight from that to a nursing home. This gentleman had been in the hospital, and then he went to a rehab facility, and he said that the nursing home was the polar opposite of the assisted living. Like, it was dark, it was depressing,
Yeah.
didn't seem like there was enough staff there. So, with Part A, what is Part A covering here? It's probably not covering the assisted living, the really nice assisted living,
Right.
right?
Right,
Okay.
right. So, yeah, so that's one thing where people aren't always aware of, that Medicare is not going to pay for you to be in an assisted living, any sort of long-term care type of situation. Really, where Medicare comes in is for skilled care. So that would be like a nurse, a physical therapist, a doctor, you know, somebody to come in and administer medications, change bandages. So really Medicare's scope of services is really supposed to be related to medical services, not your living arrangements.
Mhm.
You know, Medicare does not cover custodial care. So having somebody come into the home to cover or to help with things that they call them the activities of daily living. So eating, bathing, dressing, kind of cleaning the house. Medicare doesn't pay for any of that. So usually, and that sounds like that's more of the assisted living type of facility that your husband went to, where, you know, it's a really nice facilities and kitchen and restaurant and food and just a lot of staff. Well, you've got to, you know, that's coming out of somebody's pocket. So sometimes people have long-term care insurance, which can help pay for some of that assisted living. But if somebody doesn't have long-term care or a long-term care rider to help with those types of facilities, that's going to have to come out of pocket. So that, and it can be very expensive to get into a facility like that, where you have really good services and food and staff on, you know, on site to just be there and be part of that assisted living facility. So really that, that's another portion of retirement that really Medicare is not going to solve. Medicare is not going to solve that equation. Where Medicare does come in is just for that skilled care. So, for that the nursing facility, if somebody needs to be in a nursing facility after a hospitalization, they still need they don't need to be in the hospital, but they still need some care like physical therapy or, like I said, bandages changed or prescriptions administered. That is where Medicare will pay for that, and the service can vary quite dramatically between different facilities. So, that basically comes down to what you've done with your Medicare. If you've stayed with the traditional Medicare system, A and B, or if you've gone to an Advantage plan, that'll kind of dictate what type of access and which facilities you're going to have access to and what the out of pocket is going to look like. It can vary between the different routes that people go with their Medicare. So that's, it can be a pretty dramatic difference between, a nice assisted living facility like that somebody's probably got to be paying out of their pocket for, versus more of a skilled nursing facility type of place. That's the difference.
If I do need long-term care when I am in my retirement years, I
Yep.
would prefer to be in a nicer place that is not dark and depressing, where there
Right.
is enough staff, where, I'm eating real food.
Yep.
Is there anything that someone like me can do now in my 30s to ensure that I get top tier long-term care? Or is it just kind of like a roll of the dice
Yeah.
equation?
So there's different things that people can do. I mean, one, have a lot of kids, right? Because a lot of times people are hoping or relying, and it's kind of a difficult conversation to have with your children, but are your children going to be involved at all when you're, getting older and you're having a more difficult time taking care of yourself? It's a lot of stress to put on your children. My wife's got a coworker and she's an only child, and she is taking care of her father right now. Her mom has passed away and she is taking care of her dad who's going through a lot of different medical issues, and so she's having to juggle around, work and personal life, but also taking care of her dad. I mean, I think her dad has moved in with her since, just so that it's easier for her to manage, his situation. So, you know, children is, that's one of the variables in the equation. Obviously, you need to know, okay, are my children, are any of them going to be coming to help? Or do I need to be thinking about hiring help if it comes to that where I need some help just getting around and eating, bathing, dressing, all the custodial type of services. So that's one part of the equation definitely that comes into play. But other things you can do to financially be ready is, yeah, you need to be saving up, saving up that nest egg, that retirement money, and having enough money, because some of these assisted living facilities can be $10,000 a month to be in one of those. So it can be very expensive, if not more. I haven't seen, I'm not staying on top of the assisted living as close as, um, some other things, but from what I hear, it's very expensive to be in one of those facilities, and that can really drain your retirement assets pretty quick, right? There are state benefits like Medi-Cal can come in and help pay for some of that, but your facility options might be limited, where you can go and have the state come in, and the state would basically, they usually, I forget the specific name of it. It's not like a lien, or it's like a lien. It's not exactly a lien on your properties. But if it comes to that, the state can actually come back and say, hey, okay, we're gonna take whatever we need to take out of your estate to become whole again. So hopefully things don't come to that, but that's a backup. That is a safety net in place for folks. But thinking about things like, I know there's ways, and I'm not a complete retirement planning guru, but there are ways you can get life insurance policies, I believe, that will have long-term care riders. And maybe we should have Dave Hart, one of my dad and his business partners, in on one of these Zooms so they can talk more about different strategies and different ways that you can get yourself some sort of protection in the event we need some sort of assisted living or long-term care help, that there are other types of policies. The traditional long-term care type of policies today are very expensive, and there's not a whole lot of insurance companies, from what I've heard, is they've all been consolidating down over the years just because people are living longer. the cost of care and living is just so much more expensive today that really long-term care insurance is very cost prohibitive to get that traditional type of long-term care. So there's not really a great solution other than socking away as much money as you can while you can, having the conversation with your family and work with a retirement planner just to address that, have a plan in the event something like that happens.
Got it. So that is not a Medicare conversation. That's more of a wealth planning conversation when we're talking about assisted living, the long-term care.
Yeah.
That's a matter of you talking to someone who's skilled with retirement planning to make sure you're going to have enough to take care of yourself in
Yep.
those longer situations, not the medical critical situations, but more just in your old age.
Yeah, yeah, I think they call it longevity insurance, or that's kind of like a marketing term that the insurance industry uses. Is what happens if we're living a long time, right? So, we don't have to worry about that issue. If I'm in my 70s and pass away in my sleep, and that's it. I mean, we don't have to worry about that, right? So that's one of the things. It's part of the equation in retirement planning is thinking about that. Okay, what happens if I do live into my 90s or into our hundreds? I mean, people are going to be living longer and longer with the way technology is going, and unfortunately, Medicare is not going to cover any of that. Just the skilled care under certain situations where Medicare can come in to help, but really that's more of um, something to think about more in a retirement planning type of um, headspace than Medicare specifically. Yeah.
That is so helpful. It makes me want to kind of shout from the rooftops to everyone who's younger and just tell
Yeah.
them, Medicare is not this silver bullet that's going to save you. It's very helpful and it's an amazing tool, but it's not everything.
It's not
So
definitely not everything. Yeah, and if
when
you
you're
think of
young, you have to make sure you're thinking ahead
yeah,
and doing your due diligence, putting money in your 401k, talking to a financial planner the older you get to make sure you
yeah.
have what you need.
Yeah, exactly, exactly. Because, if you think about it, the baby boomer generation, they're all entering into those retirement years, and it's going to put a lot of stress onto our systems, right? Of how do we care for all these individuals who are aging in and needing more skilled care, or not beyond skilled care, needing just kind of assisted living. I think a lot of business people are looking into that as a business model of creating facilities, creating assisted living buildings and services. I mean, it's a huge market for that really needs to be addressed. I mean, it's going to be a huge burden. And
Mm,
each individual has their own responsibilities, but as a society as a whole too, that's going to be a huge issue in the next decade, next couple of decades, just with the amount of baby boomers that are retired, and eventually our health deteriorates, and we need care. We're not as mobile. We're not as we don't quite have that spring in our step like we used to. Yeah, it's a huge part of our society that there's definitely going to be some growing pains, some pains along with that just kind of are inevitable. So
yeah, that's
definitely do what you can to protect
mm,
yourself. Yeah.
that makes a lot of sense. And to like how everyone is kind of scattering now. People aren't staying in their hometown anymore. They're moving away from their families, and families are not insular like they used to be.
Yep.
So you have kids that are scattered and parents that don't want to leave,
Yeah.
understandably, their hometown. So they
Yep.
don't have their kids nearby to help them. So
Right.
good things to think about, like to
Yep.
chew on. One more just kind of low-hanging fruit that I need to ask you because I see this a lot on social
Mhm.
media. Does Part A cover emergency ambulance rides?
So emergency ambulance, that would actually be covered, I believe, under Part B of Medicare, B as in
Okay.
Bravo of Medicare. Since, yeah, that would be more of an well, I guess it's technically an outpatient. because when you get to the hospital, obviously, if you're admitted, that's, that falls under Part A of Medicare. So I want to say emergency ambulance trips, that is going to be covered under Part B from my understanding of it. I know
Okay.
Medicare the Medicare doesn't like to cover just transportation, when really what they say for ambulance trips is if there is no other vehicle to get you to where you need to go safely, then we will cover the ambulance. If there is another type of vehicle or another arrangement that can be made to safely transport you and it's not necessary to be in an ambulance, Medicare can come back and say, we're not going to cover that. So,
Okay.
it's kind of it's one of those things, like, when you're in the emergency, when you're in the situation, you don't really have the mind space to ask the ambulance, hey, is this going to be covered by Medicare, while you're concerned about your life, right? So it's kind of one of those strange things. But Medicare, there's so much fraud, waste, and abuse with Medicare that Medicare's got to do certain things to try and protect the legacy and the longevity of the Medicare system. So that's one of those things. And I know there's been a lot of pushback, people suing and suing the ambulance companies for not making it clear. So I know there's more to it. But yeah, Medicare will cover ambulance trips in the event of an emergency. But I think it's covered under Part B of Medicare.
Thank you so much for joining us for another episode of the Medicare Navigators podcast. We're so thankful that you took the time to listen in. All information related to this episode is down below in the show notes. If you have any questions, please do not hesitate to send us a message. Our email is also listed in the show notes for this episode. Also, our website is www.martinmedicare.com. Thank you so much for listening in.